Okay, here we are. Welcome again, everybody, to another episode of Mondays with Maishi. This is Moshe Norman from Lakewood, New Jersey, out of Lakewood, New Jersey, and it is just past 9 o'clock p.m. here where we are on March 31st, 2025. And nice to see a nice group starting out, but I don't see anybody's faces. Can we get some video? Guys, come on. No bashfulness tonight. Let's get some videos going. Thank you, Yaakov, always jumping in um, as our pioneer. And let's get started. Tonight we are featuring Dr. Margaret Blaustein of somewhere, Massachusetts, right outside of Boston. I don't know if you said Needles or Needus or Needham.
Needham.
Needham, Massachusetts. Okay, that's somewhere where the Yankees AAA or double A, or that was Tidewater, right? Okay. So tonight's topic, of course, is what we call ARC, or treating children, trauma in children through ARC, which stands for attachment, regulation, and competency. Some of you who work with children, especially in New Jersey, may be familiar with the ARC Grow program. I was fortunate enough to have some exposure to it, doing work for CSOC, doing work for doing IIC work, as I had an IIC agency for a number of years. And we recently uh, divested of that about a year ago or year and a half ago. But I got to see some of the fabulous work and structure of the ARC Grow program. So I'm a bit familiar with attachment regulation and competency in how it's structured to work with parents in a very sort of systematic, structured, manualized way. But tonight we're going to talk about ARC before ARC Grow comes in, and that is the idea of helping children through attachment regulation and competency. So, Margaret, thank you very much for joining us tonight and agreeing to do this talk for us and with us, hopefully. And tell us a little bit about, how you started, how you got into this, and what it is that you discovered and co-developed, and give us a little background as to how ARC started.
Sure. Well, thank you, first of all, for having me here. It's really nice to be here with you this evening and with those of you here. Some of you I can see, and the rest of you I know at 9 o'clock at night. It's sometimes nice not to be seen. But it's great to be here with you. So, yeah, I'm a clinical psychologist. I work with kids and families and organizations and um, really focus predominantly on clinical practice for most of the first stages of my career, but really have a love for working with traumatic stress. And that's really where my focus has always been, is working with trauma, and particularly with more chronic or complex traumas in childhood. And was working in an organization that focused on trauma, and we had some grant funded work to go out and work in the community and bring uh, trauma treatment. I'm making air quotes because most people can't see me, but to bring trauma treatment out into the community. And we found that it was really hard. It was really hard to translate what we did in our individual offices out into all sorts of organizations. And so we started to think about, what does it mean to work with kids and families who've experienced trauma in the wide range of organizations that these kids and families show up in. And so that's what led us to start identifying what we saw as some of the core concepts of intervention. I can talk much more about that, but that's the quick introduction to how it
Okay,
all
and,
began.
and and you will talk much more about that. Um, what we were talking for a couple minutes before the show, and
Uh-huh.
I guess one of the things that I'm trying to wrap my head around is what would distinguish ARC as a
Uh-huh.
trauma treatment versus just regular. I mean, if we could give, the one day up and coming mandatory parenting course that every parent will have to take before they have a child, ninth month, third trimester parents or beyond will have to take a mandated parenting course in the year 2040, hopefully, right? God willing. So, uh, I mean, attachment, regulation, competency, right? Would this not be something that would be mandated in every parenting course or class. Is there something distinct about children who experience trauma that this is
Mhm.
more important by?
Yeah, it's an interesting question. I always sort of shy away from the idea of anything being the mandated one size fits all. This is going to be the thing for every single family out there. I mean, I think that's part of what pulled us to focus in on a concept-driven approach, which is, it's not about the technique that you're necessarily using in any given moment. It's why am I doing what I'm doing, right? Like as a clinician, am I thinking about why in this moment I'm making the choice that I'm making? Do I know what I'm trying to address? Do I know what I'm trying to target? Something that you're saying that attachment regulation and competency are things that we all need is absolutely part of the foundation of where ARC comes from, right? Part of what, as we were starting to think about the core ideas of our framework is what do kids normatively need, right? In their development, what is it that we all need? Well, we all need safe enough relationships and a nest to kind of hold us and help us manage all of our developmental processes, and we need to, over time, learn how to organize our experience.
Mhm.
And we need these sort of core reflective capacities that develop over time that help us navigate our world
Mhm.
in agentic, goal-oriented, joyful, connected ways. And what happens is that when kids experience chronic stress and adversity in childhood, it shapes their development, right? It shapes their development so that their energy is going towards survival and towards reacting to sort of the next thing to come at them. And so all of that energy that for a lot of kids is going into let me try this out and let me check this out and let me see how this works for me and do I like this and what happens if I act like this in relationships. These kids don't have the luxury of that, right? Because they have to manage day to day what's getting thrown at them. So we are trying to simultaneously, and we're sort of doing three things. One is to help make the world a little safer for kids, because if the world doesn't feel safe enough for them, then you can't shift your energy away from survival, right?
Mhm.
You have to keep surviving. You can't learn all these great skills that your therapist is trying to teach you because
Mhm.
you're still having to harness your energy for survival. So we work with the caregiving system to try to make the world a little safer. And then we want kids to recognize how amazing they are, right?
Mhm.
Like all of their strengths, because all of the kids get told they're bad or they have this diagnosis or there's something wrong with them. And it's this pathology frame for all the stuff that kids have worked so hard to develop that helps them adapt to their worlds. Um, and then we also want to help them put some energy back into those things that normatively kids, we hope, are getting over the course of development, but often get left off, right, of the intervention process, like sense of self and identity. Who am I? What do I care about? What are my values? What matters to me? Or how do I make choices? That sort of thing.
Okay. So let me ask you as follows. What does the data show, or do you know, are you familiar with any research in terms of the levels of attachment, regulation, competency? I mean, I always think of everything in terms of attachment because I feel like if there's attachment, there's
Mhm.
probably stronger regulation, as it is. Um, but I appreciate the idea of attachment and separating it from regulation and having regulation as its own target. But in terms of mitigating or preventing trauma,
Mhm.
if you have children or a child whose attachment is impeccable, so to say, his regulation or her regulation skills are impeccable, how mitigated will their responses or reactions be to traumatic events?
So, the I'm trying to think about how to best answer your question because I don't think the child's capacities are what predict whether or not that child is going to experience trauma, right? Like most of the kids that I work with at the point that I meet them have already experienced pretty significant stress in their lives.
Mhm.
And, as everyone knows, dysregulation is one of the core sort of impacts of trauma. Now, obviously, there's individual differences that we all have in how we respond to events in our lives. Does attachment matter? Absolutely, right? Attachment is a huge protective factor for kids. But attachment, it's not binary, right? It's not like it's good or it's bad, right? Like I know that we have classifications and all of that, but the reality is attachment is messy, right? Like all of us, we have messy relationships and none of us is perfect in our parenting or perfect in our way of being with kids. And so when you have kids that have reasonably secure, reasonably safe caregiving systems, it buffers them from stressful experiences. But even great caregiving systems can get stressed out, right, by what life throws at you. And so often you have dysregulation that happens at that dyadic or at that family level, right? It's not just the kid that's dysregulated, it's not just the parent that's dysregulated, the whole system is dysregulated.
Mhm.
Right. And if you work in an organization, I don't know how many of your listeners work sort of maybe one-on-one, but also maybe in systems, in schools, in milieu systems, in congregate care settings. The whole system can get dysregulated, right? You have a kid that's disorganized, and then you have an adult who gets disorganized, and the whole system is stressed and reactive,
Mhm.
right? And so working to regulate the system, you're right. These two things go together. A more regulated system tends to have a more rhythmic attachment, right? And vice versa. So it's an artificial disentangling, but I think it's really important to be aware of what you're focusing on.
Okay, fair enough. I just want to remind everybody, of course, as always, if you can, turn on your videos so we can see you and have some real face-to-face contact. We always appreciate that. And of course, we understand if you can't. And for those of you who may have questions or comments, use the React tab. Click on it on the bottom of your screen and click on the raise your hand button, and we will call on you. And we're happy to take your questions or comments. Very excited to. So please, let's get interactive. Okay. When you talk about reasonably good skills
Hmm.
that parents, or caregivers have, can you give us a little overview and maybe talk a little bit about, the development of trauma in children, perhaps some of the more nuanced traumas that emanate from neglect, or, harshness that's more subtle and not necessarily as overt.
Yeah, I mean, I think it's one of these tricky things because the reality is there's such a wide range of potentially traumatic stressors that kids can be exposed to, right? Like I have one slide when I teach that lists like a range of possibly potentially traumatic exposures, and the slide is so packed with words. I had to get the font like really, really small, and even with categorizing things, there's a lot of stress out there, right? There's a lot of adversity out there. One of the things that I have come to see in working with youth and families is that the majority of parents are doing the best they can with the resources that they have. And that means that, years and years ago, when I first went into this field, I had that sort of naive idea. I think that you have sort of like the monster abusive people and the good kid, and that every traumatic situation looks like that. And certainly there are cases like that, right? Like not to um, you know, without going into depth, there's certainly cases where you have really awful things, right? Like really sort of sociopathic, awful things. Most of the time, what you have, at least in my experience, are family systems where you have parents who themselves have experienced harm or mental health challenges or not enough resources, not enough care in their lives. They've experienced poverty and substance use, which is often, of course, a response to their own life experiences. And again, mental health challenges. And of course, it then has a ripple impact on their kids. And You talked about more subtle things like neglect, for instance, right? Like sort of it's easy to know if a kid's being hit. You can see, I don't mean like it's easy to know that it's happening, but you can describe it, right? And say, this is what happened. And yes, we can decide, is this abuse? Is this not abuse?
Mhm.
Things like neglect,
Or
whether,
even emotional neglect. Let's talk
right,
about
I was going to say
emotional.
things like that are a little more subtle like that, right? Where maybe you have a parent who's really struggling with depression and really shut down or has their own like sort of extreme dissociative responses,
Mhm.
and there's just no there, right? And so there isn't that responsiveness to the kid. Um, it shapes how kids learn about themselves, how they learn about relationships, how they make meaning of their own emotional experience, right? And neglect is one of these ones that I think is actually really hard in terms of its impact on kids because when I think of the symptoms, right, again, air quotes here, the symptoms, the behaviors that kids show, which are adaptations to their world, when we think about trauma in childhood, the
Mhm.
two things that kids tend to experience is either too much danger or not enough of their needs getting met, or
Mhm.
both, right? And so the behaviors that we see in response to that are safety seeking behaviors or need fulfilling behaviors, or both, right? Well, the need fulfilling behaviors that we see following neglect, for instance, um, which are attempts to get emotional needs, relational needs, right, physical needs met, can be really toxic to relationship.
Mhm.
So
Mhm.
anyone that's ever worked with kids who've experienced profound neglect knows you've heard these kids described as they're manipulative or they lie or they steal or they're overly needy or they have no boundaries, right? And these are all like, please, please, please see me, help me, hold me, meet my needs.
Mhm.
But the result is it pushes adults away.
Mhm.
And people are like, I don't want to connect to that. That feels really uncomfortable, or this kid's really challenging or really difficult. And it just reinforces that pattern for kids of there's something wrong with me,
Mhm.
right? Which is what gets laid down in the first place. There's something wrong with me.
Yeah,
That's why
the
no one
poor
cares
get
for me.
poorer, right? They get rejected, and then that rejection just reinforces what they already know about themselves, that which is that they're not worthy and not lovable and all that.
Exactly. And so if I go full circle back to like sort of where we started, I think, with this question, um, was around thinking about attachment, right? So what do you do with that if you're working with a caregiving system? Well, think about how much of that cycle is driven in part by the child's behavior, but in part by the adult's emotional response to that behavior, right?
Mhm.
So my emotional response is this kid's being manipulative, or this kid's lying, or this kid is intrusive, and I'm reacting to that. But how different might that look if I learn to recognize my emotional reaction,
Mhm.
right? Do something with it, and then get curious. I wonder
Mhm.
why he's acting like that. I wonder why she just did that. I wonder why she just stole that thing from me.
Mhm. Mhm.
Like, what's going on there? What's happening? And that's that attunement piece, the curiosity that we really want adults to approach behavior with is, I wonder why that's happening. How do I under, and you can't do that if you're not regulated. So you got to regulate first.
Mhm. Mhm. So this is, I mean, this is really, really important. I think even as a therapist, I mean, this is one thing that's constantly running through my mind. Often like to give the example of a really annoying client
Mm-hmm.
who is, when people need emotional connection and then they beg you for emotional, could you be my friend? Margaret, could you please be my friend? Could you be my friend? And they become so annoying that you just want to push them away. And so when we come across these kinds of personalities in our therapy room,
Mm-hmm.
obviously we're going to have the same reaction or the same countertransference to them, right, that others have to them, which is that they're annoying. And if they're annoying, I want to sort of avoid them. And I may be sort of nice to them because it's my job and I'm a caring person and I don't want to hurt them, but I also don't want to feel particularly connected. And when I look inside myself and I say, what's happening to me, right? Or I have all kinds of mantras, why is it that I can't allow this person to be the way they need to be in my presence? What is it that's upsetting and triggering me? Right? Why can't I tolerate them? Why can't I? And then we lean into that what I find is that they actually begin to change. Over the course of time, they change from our behaviors.
And this is exactly why, and that's a great example. It's exactly why when we talk about our, attachment principles, and I don't mean to like always be in my lens of the language of our framework, but it's just how my brain works at this point. But
Mhm.
when we talk about our attachment principles or caregiving system principles, one of the things that we think is so important to hold is that these principles apply at every level of the system, and that includes us, right? And so exactly as you're saying, like if I am going to help a caregiver, for instance, and I use the word caregiver purposefully because I work with so many kids where they're not with their biological parent.
Mhm.
They're with aunts and uncles, or they're with grandparents, or they're in foster care, or, so sort of trained to not use the word parent, but I mean whoever is giving care to the child, which may be their parent.
It's a
Um,
parent.
right.
It's
So
a
if I,
parent.
hmm?
I said it's a parent.
Yeah. It, but so if I'm working with a caregiving system and I want the caregivers to be attuned to and curious about the child, but I am not in turn creating an environment, right, where I'm attuned to and curious about the caregiver, right? Or holding, because how often this is something that I think a lot of people who work with kids know, like sometimes it's easier for us to deal with our emotions about kids than it is to deal with our emotions about their parents, right? Or about their caregiving systems. There's an extra layer of challenge when we work with kids in that we don't have one client, we have an entire system, right, as our client and as what we're working with. And often that's not just the child and family, it's the child welfare system and it's the school and it's the casework and it's all of these people who are like intruding into our space, right? And so we have to stay really aware and curious about our own internal experience, right? And
And also, yeah, and also, I mean, well, if we're dealing with caregivers or parents, we have to pay attention. I'm assuming this is what you mean, but we need to sort of be mindful of our reactions to them to sort of parallel the process,
that's
right?
exactly right.
And I think it also offers an opportunity of modeling. So
Mm-hmm.
in the event that we are teaching them certain skills or target behaviors or concepts, we can, they can touch what it is that we're describing from
Yeah.
the behaviors that we are conveying.
Yeah, we talk a lot about the fact that with attunement, which is the really the rhythm in relationship, the curiosity and response that we're trying to build between caregivers and kids, that the first step towards that is parallel attunement, which is from us towards caregivers, right? Like a parent has to be able to say to me, I am so out of my mind, frustrated with my kid. Sometimes I just want to walk out the door. And my response can't be, oh, well, you shouldn't feel
You're the
bad.
parent, you
That's
got to get it.
really harmful if you,
You're the parent,
right.
you got to get it together here.
Right, like it can't be that, but how often is the pull to be a little bit reactive, like, whoa, that feels very aggressive, right? Like,
Mhm.
but it has to be, that sounds so hard, right? That sounds so hard. Thank you for trusting me enough to share that with me because I imagine that's a really hard feeling for you to have. Or
Right.
it sounds like that's so, things have been so frustrating lately, right? That same mirroring
Mhm.
and reflecting and validating and normalizing and everything that I hope that a caregiver can learn to do for their child, I have to give it to the parent because someone has to be seen before they can start to be curious about others.
Do you ever process that with the parent? Ask them how it felt to be responded to in that way?
Sure. I mean, it depends on the situation, but I think that
I guess, I mean, is it effective to do that? If you noticed how calming and receptive you became, and
mhm.
I reacted that way to you, can you now emulate that and bring that to your child?
Yeah, I mean, I think that there's a lot of space in relational work to slow things down, right? And I think often we, our field in general is very focused on outcomes, right? On what are we doing and what's the task and what's the therapeutic choice that we're making. And oh, so much of the work happens in the moments of saying like, wow, I noticed that everything just got calm. Did it feel like that to you? What
Mhm.
did you notice, right? And inviting someone into that process or sitting with the affect or sitting with the experience. And I do think that we can absolutely invite curiosity about, like, I'm curious about what in that moment helped it feel like that for you,
Mhm.
right? I also like to do a lot of, if we have things together, having caregivers and kids together in the room and noticing moments where that happens. Like, hey, mom, I noticed just now when you did X, she smiled. Did you notice that? Right? What was that like to her? It looked like you just got really proud. Because we get so caught up, when I think when there's so much stress in our day-to-day lives, we get so caught up in noticing the bad stuff, noticing the hard, right? Like, I mean, how often have you sat with a family, for any of you working with families, and you're like, tell me about all the great things in your life. And they're like, what? What do you mean? There's no great stuff in my life. There's nothing good going on, right? And so being able to shift to notice not just where is everything hard and where do you feel terrible about yourself and where are you struggling, but also like what's one thing today you did that you felt kind of proud of,
Mhm.
right? Where you felt like I had this, like I did this, I felt really good about this. That's great, right? It doesn't minimize, it doesn't negate all the stuff that feels hard, but like, boy,
Mhm.
we need that feeding of our soul, right? To be like, yeah, I did that. That was great.
Hey, ladies and gentlemen, I just wanted to announce that I see some new names that seem unfamiliar to me here in the participants bar. If this is your first time here, well, welcome aboard and congratulations for joining. You found the right place to come to hang out on a Monday night, and we hope to see you here weekly. And if it's your first time, give me a little back channel DM and I'll give you a shout out. Okay, so let me know that it's your first time here. If anybody has any questions at this point or comments, please raise your hand using the React tab on the bottom of the screen and click the raise your hand button. And of course, I want to thank Aaron Herzog for making this connection between me and Margaret. So thank you, Aaron, and good to see you on here again. Okay, let's get a little bit more into the meat and potatoes of ARC.
Yeah.
If I understand correctly, this is a program or concepts that we're teaching, educating to institutions that work with children.
Yeah. Do you want me to walk you through it a little bit?
Walk me through it all the way,
Okay.
not a little bit, all the way.
All right. So ARC, I laugh sometimes because there was one training we did. I'm going to tell you what it is in a second, but I'm going to backdrop it with this moment. I was doing a training with my colleague Christine Kinneberg, who's the co-developer with me of ARC, and we were doing one of our early ARC trainings. And someone wrote in an evaluation after the training, it's like they took everything they ever learned about childhood trauma and stuck it in one framework. And I was like, I think that was a criticism, but that's exactly what we did, is we took everything we knew and we threw it into one place and tried to organize it. So ARC is it's a core concepts framework, which means that as I think I said earlier, we uh, really tried to identify what does it mean to work with kids and families who've experienced trauma. What do we think is most important? And how do we fit that all together? And we found that when we looked at everything, and this has been a 20 plus year process for us. We wrote our first manual back in 2004, and we've been refining and doing this work now over the years, and really in a sort of dual learning process. We do things, we work with organizations, we learn from them, we refine what we do. So we organize these targets into these three domains: attachment, regulation, and competency. At its heart, right, we're trying to support adults who are in kids' lives and themselves feeling supported and we talk about it being a regulated and a regulating caregiving system.
Mhm.
We want caregivers to feel supported and regulated because that lets us as adults support kids, right? Which is sort of normatively what we want the attachment system to do. And then because kids who've experienced trauma have such overwhelmed, dysregulated physiologies, right? Which are so caught up in self-protection. And that can look like heightened arousal and fighting and really getting dysregulated, it can look like shutdown, right? It can look like the kid who's trying to be the perfect kid, who's complying with everything because they can't feel anything. So we see that show up in all sorts of ways. And so we focus on how to help kids learn how to regulate themselves. And then the last piece is we think about all of those areas of reflective competency, right? The stuff that our brain doesn't have time to focus on because it's so busy surviving. So, connection, identity, who am I, right? And what do I want? Executive functions. How do I make choices? How do I work towards something? And each domain breaks down into targets. And so we have the targets, and each target breaks down into sub skills. And what we do is we use this framework as a way to teach, whether it's clinicians who are working one-on-one with kids, or whole organizations or systems that are sort of working in much larger ways, what the concepts are, and then we drill down to the ground. What does this look like in your clinical practice with this particular family, in the work, et cetera? Because as all of you know, your clinical work looks really different, right? If I have one family come in and it's a grandmother who's raising her 5 grandkids and she's struggling with all sorts of lack of resources and whatever else, and then I have a different family and they have a very different family structure and a very different cultural background. The work's going to look slightly different, but I'm probably still focused on how to support that caregiving system and how to help the kids learn how to regulate their experience and make meaning of their lives, what's happened in their worlds and who they are. So the concepts stay fairly constant, but the way we apply it really changes. And it starts with our own attunement, our own curiosity about who people are. And that's, I think, a core part of doing this work is starting with, I really want to try to understand why people make sense, right?
Mhm.
Like that's one of my core foundational meaning makings about how people present. People make sense. They do what they do for a reason. And so if I'm going to engage in clinical practice, I have to understand who someone is.
Mhm. And then how is that something that you teach to others?
So we talk a lot about um, there's a lot of ways. Part of it is talking a lot about the ways that trauma influences developmental pathways, right? How do you get curious about what's underlying a behavior? So I use the example sometimes, right, that you can take a kid, like take a kid in a first grade classroom, right, who's sitting in the classroom and the teacher notices that this kid just is wiggling all the time. They're wiggling and they're looking in the hallway and they're not paying attention and they're moving around a lot. And I could say to you, and I could say it to your group here right now, what's a reason why this 6-year-old might be wiggling in their chair?
Mhm.
What's a reason why this 6-year-old might be wiggling? I'm curious, actually, if you all throw into the chat, what's a reason? I won't say your names, I promise. What's a reason that a 6-year-old first grader sitting in class might be sitting there and wiggling and looking around and not paying attention to the teacher? I'll wait
Let's
to
give
see
us
if
a
I get
green.
any responses. Okay, love it. First response, they might need to pee. People always forget that one. And I'm always like, come on, it's a first grader, right? Like, that's the obvious one. They might need to pee. They might have sensory issues. They might have ADHD. They might be hungry, right? Like, I could come up and we could keep going. I'm not going to keep going here, but we could keep going. They might be anxious, right? They might be like turning to look at the hallway because they keep hearing noises. They might be overwhelmed being around people, right? So, there's all of these reasons, right? And I could have 7 first graders in 7 different classrooms who are all engaging in that same behavior for 7 different reasons. And if I'm the teacher and I've decided that the reason, that doesn't even matter what the reason is, I've decided that the intervention for every single kid who is wiggling in their chairs, they have to come sit right next to me. And that's going to help them focus. Think about that list we just read. How many of those kids is that going to help? I mean, maybe one of them, right? But it's not the rest of them. So we start from this premise that it matters to try to be curious. And that now I may not know what's happening. I could ask the first grader. He might not know what's happening,
Mhm.
right? Because first graders are first graders. They may not know, but I might pay attention to patterns. What do I notice? right? We start off with talking about what has this child experienced in their life? How might those experiences have shaped their understanding of other people? How might it have influenced their approach to relationships? What are you noticing, right? We talk a lot about how every crisis is an opportunity to learn, right? Every time there's a situation, we're learning something. And I think we can all get caught up in reacting to the crisis, right? And reacting to the thing that just happened. Oh no, this kid got really upset and threw something, and we got to react to that and come up with a plan and come up. But like, you can do all that, but you can also pause and take a step back and say, huh, what did we learn? What was happening at the time? What did we notice? What happened right before he escalated, right? What do we think he might have been trying to do in that moment? Did we try anything? Did it work? Did it make things harder? Mom, what was your reaction like? Are we learning something about what you needed in that moment? Because it sounds like you got really upset and just completely weren't sure what to do. That's really important to know because it means that next time we got to think of some strategies for you, right? That we practice before we even get into that situation. So you don't have to think because in the moment that stuff is happening, you're not going to be thinking. Your limbic system's going to be going off. So we really drill down with clinicians into that curiosity piece, right? How do we start making meaning out of the patterns that we're seeing? And how do we pull in everything we know about development, about attachment, about relationship, et cetera? The way we do it in practice is we do a lot of application. So, like when I train an organization or we train a group of people, then we spend a year talking about cases together.
Mhm.
And we say, okay, so now we're going to take this case and we're going to talk about how these concepts apply for your case. And then next month, we're going to take a different case and we're going to do it for that so that we start thinking about how the same concepts can get woven in a really wide range of ways because we want people to be thinking about that.
Okay. Let's talk a little bit about the three core targets and let's break down each one, attachment, regulation, and competency.
Okay.
Tell us a little bit about, go.
What goes into each one. Okay, so we call those actually our domains. The targets are within the domain. So the first attachment, like I said, is about I'll sort of briefly name what each piece is, but attachment is really focused on building, as I said, a regulated and a regulating caregiving system. The three targets within that are caregiver affect management, attunement, and effective response. And we're trying, and I wonder, would it be helpful for me to put a slide up?
Sure, go right ahead.
I'm gonna keep talking because I gotta find one. Um, but let me see if I can pull one up while I am talking to you that shows uh the ARC framework. Okay, here we go. So let me, if it's okay for me to share my screen, at least those of you who are on now, you'll get a little bit of a visual. Hopefully that popped up. So this is a visual of the ARC framework. And down here on the bottom in the yellow, for those of you who can see this slide, these are what we call our foundational concepts. And these foundational concepts are foundational because they come into everything that we do. Okay, so they're not targets in of themselves, but they are part of and infused into all of our work. So in everything we do, for instance, we're thinking about engagement, right? We want people to feel like they have stake in the process, like they're invested in it. We want to feel invested in it. So we always want to be curious about how the work that we're doing aligns with the goals that are important to someone, the process that feels valid to them, et cetera, right? So that we're really paying attention to that. And I think that's particularly important when we're working with communities that have been impacted by trauma, because there's a lot of disempowerment that has already happened in their lives. And so we really want to think about this sort of collaborative frame that we're building with people. How are we being transparent? How are we engaging in collaborative processes together? So our foundational concepts here, engagement, education, routines, and rhythms. In the attachment domain, we have these three core targets that we're focusing on. Caregiver affect management I sort of feel like this is like the biggest one. I always laugh because when we first started doing this work, we thought we were going to spend all our time focusing on the kids.
Hmm.
And every single consult, like really, like the whole time was spent talking about like mom's reactions or dad's anger or this, this caregiver is really depressed or they're really frustrated with me. And we spent so much time talking about this one domain. It's a really big driving factor, I think, in the clinical work that we do is the emotional experience of the caregiver. And so we focus a lot on how to start with really tuning into the regulation needs, the support needs of the caregiving system, but in a way that's not shaming or blaming,
Hmm.
right? Like we want the message to be, of course, you're having a hard time right now. It makes so much sense that you're having a hard time. Let's work on that, right? Like, let's figure out what we can do to support you. And the tricky part is sometimes we say, well, I'm the child clinician. My job isn't to be mom's therapist,
Hmm.
right?
Hmm.
And that's okay. And that's good to acknowledge. And then we think about, okay, but can I identify that this is a mom who's struggling and think both A, how does this impact parenting and become therefore relevant to the work that I'm doing? And can I identify some resources to connect the caregiver with, right? So it doesn't always have to be us doing the work directly.
Hmm.
So caregiver affect management really focuses on the emotional experience of the caregivers as relates to parenting, right? So that we're being careful with our boundaries. Attunement is about that relationship between caregivers and kids, right? Building curiosity, um, working to understand what's underneath the behaviors, building rhythmic responses through things like mirroring and reflective response, and really helping caregivers use that curiosity to try to understand what's driving challenging behaviors. Um,
And I imagine you have like millions of examples and illustrations to bring out what that means, attunement, even affect management.
Yeah, I mean, this is what I'm showing you right
Hmm.
here that I'm
There you
trying
go.
to do very quickly in
It's the
5 minutes.
outline.
This is a 2+ day training. So we
Mhm.
spend we spend a lot of time on each of these concepts. Maybe I'll just briefly name the targets, then I'll take this back down so we can see each other. But so effective response, I always say it's kind of how do you use your affect management and attunement in service of responding to youth behaviors. And so this is less about what you do than the process of how you do it. Okay. Regulation, we have two core areas, identification, which is helping kids notice their own internal experience, what's going on with me, how do I understand what's happening inside of me, and modulation is the tools. And what do I do with that, right? So that is sort of building, and you can go in any direction here, right? You don't have to have kids who can name emotions to be able to engage in physical practice. Sometimes it starts with the physicality,
Hmm.
right?
Hmm. Now, is this something that you do with the children, or this is something you're teaching parents, caregivers?
This is all with kids. So the I mean, and of course it depends, right? It depends how you're working. But typically I think of the attachment targets. This is what I'm doing with the caregiving system, whether that's parents or whether it's a system of care. And up here, regulation and competency, this is what I'm doing directly with kids
Hmm.
or what providers are doing directly with kids. Now, certainly, with very young kids, you're working with parents to facilitate these things. And in some situations, you're doing parent work only or kid work only, so it can work in a variety of
I,
ways.
I want to jump to Yoel's question in the chat.
Okay.
I guess my own form of it for a minute, which is what happens if you have parents who are really limited in whether it's regulation, whether it's attunement, in getting the concept for whatever reason, or being able to apply the concept for whatever reason. Um, how, do you work that hard to imbue this in them in some way? Are there limitations?
Yeah, I mean, I think this is I shouldn't say most, I don't want to generalize like that. I think a lot of parents struggle, right? We certainly, I mean, I get families who come in where the parents are like, yes, I want to learn and I want to understand. And that's amazing and wonderful when it happens. But again, the population I work with is largely um, one where the entire system has experienced a lot of stress, right? And And it can be hard to read what's happening in someone else, right? And you can't force it. Again, for me, I think parallel attunement is a huge part of the process, right? Like it really starts with, a caregiver comes in and my kid was so awful and this and that. And you gotta start, I don't want to just jump into, I wonder why your kid was so awful this week, right? Like what's going on? Let's try to figure that out. Because then the parent doesn't feel heard or seen. It's gotta start with, um, it sounds like that was a really hard weekend, right? Like, how are you doing with that? What did you do for yourself? It sounds like you guys got into a lot of back and forth. What was that like for you?
Mhm.
And I wonder if we can take a step back and
Mhm.
figure
Mhm.
out what might have been going on, right? So there's a process for that. I think that we often skip over the caregiver experience and jump right to the curiosity about the child. Now, obviously, there are times when we've like attuned over and over and over and over again to the parent and they're still not going there. One of the things that I always try to hold is I can validate someone's experience without stepping into their lens, right? So I can say to a parent, it sounds like that's so hard. And I get that you truly believe that she is doing this on purpose to push all your buttons because she just wants to XYZ, whatever it is the caregiver. And I don't see it like that, right? And I can share with you how I see it. I think it probably feels awful for you, given that that's what you're saying it feels like to you, right? That's what you believe. And I imagine if I believed that, I would feel horrible too. I would be angry and frustrated, and I totally understand why you're feeling that way. From this step back where I'm sitting, I have a slightly different perspective
Mhm.
on what I think might be going on, right? And I'm more than willing to share that with you and see if that might be helpful because what you've been trying hasn't been working so well, right? And that's got to be really hard for your whole family. So it's I think a gentle process over time. We talk a lot about there being I talk a lot. When we talk about trauma experience integration and ARC, the way we think about trauma experience integration, um, this is its whole own day, so I'm going to keep this brief, but essentially stepping away from the idea of just telling the story, right? Like, what is the story that you're telling when you're talking about chronic stress and multiple layers over time? We talk about trauma experience integration as being the movement towards engaging in present action, okay, in purposeful ways, with the idea that trauma and the survival urge stops us from engaging in purposeful action. It keeps us in a survival space, right? And so when we think about our work, and there's a much longer conversation about that, but when we think about our work, we think about sort of three states that guide our work, and how we do our work depends on the state that we're sitting with in that moment, which can change, right? And if you have clients, that there's often this movement through states, even within a single session. So sometimes our clients are in a survival state, right? Well, when someone is presenting in a state that's all about surviving and that trauma response and that overwhelm, our goal in that moment is to help them build capacity to get through that moment, right? We're supporting all the regulation they need. We're helping them develop the skills they need to move through that moment. Sometimes people are in a more curious state. They're sort of grounded, they're able to be curious. Maybe they're not ready to do something different yet, but we can work to engage curiosity. So we've been through the survival state, and now we're going to catch the moment and say, I wonder what was going on with that, right? Like that sounds like that was really an off kind of thing. I wonder what happened with that. And we're engaging someone's curiosity. And then the next minute we're back in the survival state, right? And then we're regulating again. Um, the movement towards that third state, which is action,
Mhm.
only happens when someone is motivated to take action. When they say, I want my relationship with my kid to be different. I want to stop getting in fights so much. I don't want to get in trouble at school. I want my relationship with my mom to be better, right? Like when you have that, that's when you have the entry point to be able to say, let's try to figure out what you can do in this moment, right? And we have to bring all of that curiosity and the person's own awareness of their behaviors and their needs and what they can do in that moment to bear. But you can't get to that place of action if someone's not ready to be there.
Hmm. Hmm.
And so I think we have to work with the state we have, which can be really hard sometimes when we're talking about kids who are obviously more vulnerable to the impacts of what their caregivers present to them.
I have a strange question, but how much of this could be applied to parents of adult children and their adult children in terms of healing
Mhm.
relationships?
I actually think a lot. I mean, when I do less clinical practice now because the majority of what I do at this point is training and consulting. But I worked with adults for years, and the adults I worked with were, almost universally adults who had experienced trauma as kids.
Mhm.
And so much of what we talked about um, was parallel to the work that I did with kids, but it was different, right? Because it was
Mhm.
with adults. And I think, attachment matters at all ages. I mean,
Mhm.
the research shows like attachment doesn't stop being relevant just because we hit 18, right? We form meaningful attachment relationships with partners and with our own kids. And, there's this continuity of attachment with our own caregivers. I think things look different, but again, all of this is sort of grounded in normative developmental needs and capacities.
Mhm. Mhm. Okay, let's take Aaron's question. Go ahead, Aaron.
Hi, you hear me?
Hardly.
Bye bye.
Can you put the mic? Do you have a mic that you can put closer to your mouth?
You hear me now, better?
Yeah,
A bit.
a little
Hi.
bit.
Say hi. My understanding was that you're trying to build with the child attachment, regulation, and confidence. Did I understand it well? Like this is the three things that it's the most important: attachment, regulation, and confidence.
Well, these are the domains in which we named the targets in our framework, right? There's a lot within that we're trying to build.
Then my understanding was that in order for the parents to give it, they have to have it first. Is this correct?
Um, in order for the parents to get, so let me just repeat to make sure I'm hearing you, that you're understanding that I'm saying in order for parents to give whatever warmth, nurturance to their kids, they have to themselves experience. I would say yes and no. And no, in the sense that I work with a lot of parents who are amazing, wonderful, nurturing parents who did not experience amazing, wonderful, nurturing parenting themselves. Um, and so I think people absolutely can build attachment relationships having not themselves had what every kid deserves, right? Um, and I've worked with a lot of parents who say like, all I know is I want to do with my kids exactly the opposite of what was done with me, right? And so they build so much for their kids. I think where it's the yes, because that was the no part. The yes part is if I have a parent who's really struggling and who themselves is experiencing a lot of need and a lot of distress, I think often the path towards them in turn being able to regulate and support their child is them having a nest, right? I sort of say like so much of this work is about this series of different nests,
How do
right?
you how do you help them having a nest?
How do I help them have, and I apologize, I'm like repeating just to make sure I'm hearing you because you're a little hard to hear. So how do we help them have a nest?
Yes.
Yeah, I mean, if I had the magic answer to that, it would make my work a lot quicker and easier. I think there's a few things for me, right? We think in terms of what are the levels of resources that parents need. I don't have a magic wand. I can't create these for parents much as I wish I could. Um, but I think about what can I do as an individual provider working with a family system? How can I communicate support to a parent in a way that like really genuinely says like my goal is to support your entire family. Like obviously I'm the child's therapist, but um it's hard to function as a family if you're totally drowning, right? This is the oxygen nest on a plane. You got to put it on first because if you pass out, you can't help your kid. So we think about what are the resources they need. I encourage all systems to really make linkages with other systems. There's great resources out there. I love things like parent partners and parent to parent supports, peer support groups. I think people can find community in all sorts of places, right? Like thinking about religious or spiritual community, thinking about community-based resources in various ways. Sometimes parents feel isolated, and you're like, what can you do? Like, how can we get you less isolated? Where can we connect you with some other people? So I don't think there's only one answer to that. Um, but I think holding it as an important priority is something that we often lose sight of, right? Like I think there's in the larger child mental health field, I think often either an inadvertent or an explicit blaming of parents for their kids' presentation without recognizing how much a lot of parents are struggling, right? Or understanding their presentation in the context of their own experiences. And so I think we have to hold it matters to support adults and go from there, right? And then start to try to figure out how to do that. You know, one of the things when I used to start talking about attachment, now I feel like we tons of people talk about attachment, but 20 years ago, I feel like there was a lot less of conversation about how important it was to work with parents as part of child treatment. And people would say, like, I don't get it. How do you get parents to take part in treatment? And I said, because when they come and start to work with me, one of the first things I say to them is that I'm someone who really likes to work with parents as part of my treatment, right? Like that's part of our conversation from the beginning. And and we talk about like that's not always comfortable. So we're gonna have to figure out a way to do this. Let's figure that out. What will work for you, for your family? What are the obstacles gonna be? But if it's not even in the conversation, it's not gonna happen, right? And so um holding that I think is really important.
Hmm, okay. Would you be able to bring the PowerPoint back up?
Sure.
Because I know we did competency, we did some regulation, or did we finish the regulation? We did regulation, which was modulation and identification. And then we have relational connection,
Yeah, so
which I
so
think we understand. Executive functions, which sounds more like practical problem solving skills and development of skills. Yes?
yeah, so that's really about how, you know, every time our limbic system, every time our arousal system surges, our
Mm-hmm.
prefrontal cortex shuts down,
That's down. Mm-hmm.
right? And so we know that kids who experience early trauma and chronic trauma really struggle with things like decision making and attention and concentration, all of these things that require that effort of the prefrontal cortex. And I think of it like a muscle that just hasn't gotten flexed as much as it needed to,
Mm-hmm.
right? It's not that they don't have the capacity for it, it's that
Kind of
thinking,
behind in the learning.
right? Well, and because thinking is a luxury that you have only when you're not surviving.
Mm-hmm.
Right. It's a luxury. It's a luxury to stop and pause, right? Like I use the example of if you're in the middle of a street and a car all of a sudden rounds the corner and comes zooming at you, you don't want to stop and be like, I wonder what make a car that is. Oh, that's a pretty color. I haven't seen that on a car lately. Like you don't want that to be what's in charge. You want to be jumping first and
Mm-hmm.
thinking later, right? And that's our brain protecting us. Well, for our kids, that car is coming at them 50 times a day, but it's doing it in math class and it's doing it on the school bus and it's doing it in their family. And it's right. It's like they're constantly having that search. Doesn't have to even be actual danger, right? We all know this. It's not like you have to be in actual danger. Your brain has to tell you that look that person just gave you is dangerous. This person sitting too close to you is dangerous. And you shut down, right? And so we're trying on the one hand to help kids really experiment with what does it feel like in my body to feel comfortable, right? Like, what does that mean? What does that feel like? What helps me feel comfortable? And as I have that, how do I start to figure out what I want and to make choices? Okay. One of the things we talk a lot about here is the importance of agency. That that knowing that what you do matters. When you have had no choices, when you have not had power, and like, let's face it, kids have very little power in the best of circumstances, right? But kids who've been hurt over and over again often have even less power, right? So when you've been shown by life experience that you have no power and no choice, and then someone says to you, you need to make good choices.
Mhm.
The kid's like, I don't have any choices. What are you talking about?
Mhm.
Right? And so even just starting with like giving kids options, right? Like which of these do you like better? Do you want to do this first or do you want to do that
Mhm.
first? Right? Like how do I bring that into bear? Or being the external scaffolder. And this of all the skills in the framework is the most scaffolded. This is the most adult scaffolded skill because no one, no 6-year-old, no 10-year-old, no 12-year-old has great executive functions. Right. But what we want to get into the practice of doing as a kid gets really frustrated with something and that's really hard. And we say, wow, that's really hard. Would you like some help figuring it out? Right? Or we say, I'm going to go do this thing. I'm going to go punch someone. You could do that, right? You could do that. Let's think through why you're doing that. Like, what are you trying to accomplish with that? Well, I want to show him what a jerk he is. Well, that would probably show him what would happen if you did that, right? Like, so being in that position where instead of telling kids what to think and what to do, we model and engage them in the process of thinking it through
Mhm.
themselves and
Mhm.
learning how to do that.
Mhm.
So that's that
It's
target.
creating new neuropaths for them.
Exactly, exactly. And exactly what you just said, which I think is so critical, the idea of neuroplasticity, right? Like the idea that part of the reason that trauma has such a profound impact in childhood is also the reason there is such profound opportunity for resilience and resource.
And when you're working with a child,
Yes, that
yeah,
that that in
while
other
they're still a
words,
child.
right, that there is kids continue to develop and grow, right? And their brains continue to create new pathways. I see that there's a hand up,
Yeah,
so
let's take a
thinking
question.
maybe we'll take a question. Yeah.
Yeah, go ahead. Whoever's hand is raised.
Yeah, hi. Hi, it's me. Yeah, hi. Um, so I had a few questions. Someone asked me about her child. I work with, with children. Someone asked me about someone who child experienced a car accident, tragic one that happened 2 days ago. I'm talking about a different one that happened a week ago. And her other children were walking. They're walking together, and her daughter was like hit by a car, but nothing happened. Or like, oh, like thank God everything worked out well. She wants to know if they should, like, she isn't talking about it at all, but some of the kids seem a little bit dysregulated because the other children also witnessed it. They were on the way home from synagogue, and
Mm.
so she wants to know. It seems from what she's telling me, it's a very stable home, very loving, and the question is, does she think her children should speak to someone because they witnessed it, and
Right.
they're very shut down. One is very shut down, and the other, like, she isn't talking about it at all. The one actually was almost hit, or maybe was slightly hit. I'm not sure.
Mhm.
And the others are, like she said, appear to be very like nervous.
How old are the kids?
I'm
Without
not
going
really
too
sure. She asked me because I work with this. One of my colleagues at
okay.
work asked me her friend's children.
Okay. So
Um,
let me
I
let
think
me
five, maybe the one who was almost hit, maybe. I'm not sure.
okay.
Maybe the other ones were like 11, let's say 10, 11, 12,
Mhm.
13,
So
maybe.
elementary school age, sort
Yeah,
of elementary, middle school. Yeah, and I'm only asking because sort of developmentally, obviously, what we do is a little different at different ages. So I'm stepping outside of my ARC hat for a minute, and I'll say like I'm in my ARC hat only because that's my like entire clinical hat. But ARC is really more a chronic trauma, and this is more of an acute, immediate trauma kind of
right.
thing. So, what I would say, A, there's no like right answer. Someone should definitely speak to someone or not. I think some of that
Right.
depends on the family's comfort with themselves having conversations. One of the first things I would say is when there is an acute incident like this that's really scary, it's distressing. I always want to reassure parents that it's not like, having an acute, potentially traumatic, I don't even want to say traumatic because we don't know if it is or not, right? We don't know how the kids experienced it, but an acute, potentially traumatic, but certainly very stressful experience isn't
Yeah,
like a guarantee that kids are going to have negative outcomes. And I think that's an important thing for parents to hold, is that in what you're describing, a loving home with lots of supports and resources, scary experiences happen, right? And part of our job as parents is to help kids metabolize those. Some of the things that I think about doing, number one is I do like to put language to things, right? But without so much information. So something really scary happened the other day, and
right.
all of us, kids and adults, have such a mix of reactions sometimes to scary things. And sometimes when scary things happen, it might make us feel nervous or worried. It might make us have a hard time sleeping. It might make us feel like we want to be with other people more. Sometimes we want to talk a lot. Sometimes we don't want to talk at all. All of that stuff is normal. Okay. If you have questions, here's who you can speak to. Do you want to talk to someone? So, in other words, putting a little bit of a frame around the experience. I think one of the best things we can do for younger kids is for parents to have a little bit of education about sort of what to be on the lookout for, right? So, in the few days afterwards, we're still in the acute, we're not even in like the acute stress response yet, right? We're just in the immediate something stressful happened and our bodies are responding to it. If you look on the National Child Traumatic Stress Network's website, they have lots of resources.
What is
On
it called?
the National, I'll put it in the chat, National Child Traumatic
Yeah,
Stress.
thank you.
And this is the national sort of collaborative network of sites in this country that are funded to address childhood trauma. And so there's a lot of educational resources. I think it helps parents to know what to expect in the aftermath of stressful experiences. Books can be helpful for little kids, right? Like just even reading about a stressful thing that happened and how kids respond. Most of what I want to do at this point is reestablish safety and rhythm and normalize the range of responses.
Yeah. Thank you so much.
Sure.
Also, can I ask you another question or
Oh, what if it's really quick, because we're gonna have to log off in a minute.
no, it's not going to be really quick, probably.
Okay.
I
Okay,
want to
so
ask about another case that I personally work with, but yeah.
well, okay, maybe you could get some resource or email address or some way to contact Margaret.
Okay.
Margaret, tell
Thank
us a
you.
little
Thank
bit
you so
about
much. I really appreciate it.
any resources, any ARC resources that people can access, any trainings that you guys are doing or affiliated with. Give us some resources.
Sure. So I did just plug the NCTSN's website, and that's less selling me than selling what I think is a really fabulous resource on childhood trauma that's out there. I really recommend that people explore the site. There's a lot of free information there. Our website is arcframework.org. I'll put that in the chat as well. There's a lot of information about our work. Oh, I can't type and talk at the same time. Or search up ARC or search up my name and it should pop up.
Mhm.
We have a book that describes the work that we do. It's treating traumatic stress in children and adolescents, and that's what we have. So I would say feel free to explore our work on our website, take a look there. And I'm happy to be in touch with people. I put my email in the chat.
Okay. Well, thank you very much, Dr. Margaret Blaustein of ARC, and of course ARC Grow, which you can learn more about. And it's a very nice resource for parents. Therapists can teach parents, or clinicians can teach parents about the ARC Grow program. And thank you for joining us. Thank you for doing this talk for us. And hopefully some of you will reach out and take advantage of what's out there.
Thank
Okay.
you so much for having